It's Mari McInerney from Croakey here at the AUSMAT conference in Darwin, and I'm speaking here with Tom Randell. Tom, can you, just given one of the keynotes at the opening plenary, can you say what your presentation was about?
Thanks, Mari. I did a presentation this morning about the AUSMAT radiography service when we've been deployed overseas. I've personally been over 5 times. Ranging from the response to cyclones, some public health emergencies for measles, COVID, and some research helping out in the TB prevalence study in East Timor.
And what made you put your hand up for this? Because we heard actually from the speaker before you about how the recruitment program is very rigorous and quite demanding. What was it that appealed to you, and how was it to get through that process?
Well, the trauma team had already been deployed to places like the Pakistan floods, the Banda Aceh tsunamis, and they wanted to move to the next level. They wanted to upgrade their field hospital to include radiography services. So they came to us, we worked in the same building, and they came to us and said, hey, we need some energetic, outdoorsy people who are happy to help get their hands dirty and be a part of this team. What do you think? So we had expressions of interest, and I was fortunate enough to be selected. And yeah, we went from there. We did the training course. The training course is very rigorous and exposes you to a lot of things, not necessarily about your actual profession, but the things and the people and the situations that you might come up against.
Like what?
So we were trained in driving in convoys, speaking on radios. We got ambushed by the TRG. We had to go through passport control, do our research as to where we were going, what we were going to find. And most of the places, English is a second language, so you can go over with the best of intentions, but communication is key in healthcare, and so when you don't speak the native language, it's always going to be challenging to be able to help in these situations.
And was the selection criteria and the training right in your regard, or did you get there and go, yep, I'm made for this?
The training was sensational. Mm-hmm. It was real world, it was hands-on, so that is me. I don't like paper. I just want to get in and do. So yeah, the training, I was like, yep, I love the outdoors, tents. A challenging work environment is great. That's how you can do your best work, I feel, when you're not necessarily following the everyday routine, when you're doing something out and above.
And talking about those deployments that you've done, let's talk about what have been the best, what's been the most rewarding?
The most rewarding was probably the Philippines, our first ever deployment, because the hospital had been flooded, washed away, the radiography, it was the only X-ray machine working for miles and miles and miles around. No other field hospitals had one at the time, and so patients were being brought to us, and at the time, sometimes people in Australia take healthcare for granted because it's always available, and has been available for a long time. Whereas we were greatly appreciated because it was we were a service that was not available from anyone else, so everyone just appreciated us. It was just really rewarding to be able to help.
You said you were really struck by the community spirit, for example, in Vanuatu after the cyclone there. What struck you particularly there? What was an example?
The example was the nurses, radiographers, the local footy players. Everyone was helping with the cleanup. Everyone was helping to get people to the hospital in makeshift ambulances or the like. And yeah, as I just touched on, when the hospital ran short on blood, volunteers off the street were brought in and the supplies were back that afternoon. Just, yeah, people don't know that they need to be, might not know that the hospital needs help, but as soon as they do, everyone is in there and just helping out.
And what about, they're the most rewarding ones, what about the most challenging, the most difficult, scary, confronting?
I think the most challenging was the deployment to Papua New Guinea. It's a dangerous place, or can be a dangerous place.
Tell us why you deployed then.
I deployed because if in our role with AUSMAT, we are tasked by the federal government to go somewhere, and we are tasked because the host country has requested us, and they are crying out for assistance in any way possible. It's a dangerous place. It's an unknown disease, but the thing that I found most confronting about it was the need for constant PPE to treat people. You're trying to create a rapport, and you're blue with a great big orange duckbill mask. It's just pretty confronting, and you're there with the best of intentions, but not necessarily, the patients don't necessarily know that to be the case.
This was the beginning of COVID,
this is
really unfolding there. It was, you said it was unknown here too how it would be, but and there was a high mortality rate in Port Moresby when you got there. How did you address that?
The team worked together and set up a whole heap of strategies to move patients into safer areas, train local staff in the care of high acuity patients, and all work together as a team. And when you all work together as a team, the results just speak for themselves. It all comes together, and patients are saved.
I think most people, when they think of AUSMAT, they do think of earthquakes, floods, cyclones, etc. But one of the things you did was for a measles outbreak, and in fact, AUSMAT teams are deployed in Australia as well. What's it like going into those situations?
So going into the measles outbreak, it was it's confronting. We hadn't had measles much in Australia at all in the recent past. So I had to be educated on the sort of PPE I might need, which was great because it was very minimal. And so in that regard, you could create a connection with the patients and not seem like such a stranger to help provide the care.
We were told today at the other presentation that allied health is really needed as part of AUSMAT. What's your view on that? Because everybody thinks of doctors and nurses. How important are you and why?
Yeah, well, allied health as a whole makes the picture complete. Without allied health, there's no physios to help with the recovery of patients. If people are injured, it's not just a sew up out the door service, it's a complete service. There needs to be diagnostics, there needs to be rehab, there needs to be a whole team approach. That's why there's allied health in Australia, so that's why we need allied health in a field hospital.
And what's one of the most surprising things that have happened to you on a deployment?
The most surprising thing.
In a diagnosis or in a logistical sense?
I was going to say the presents at the end.
Oh, really?
It's nearly embarrassing, but I got given a shell necklace, which means that you're suitable to marry my daughter in Papua New Guinea. I was like, oh, this is a lot. But just the tokens of people's appreciation is really warming.
And what's the main thing you'd like the medical radiation sciences to have got today out of your presentation?
Oh, just a little bit of an insight that anything's possible when you all work together. We came from humble beginnings of a shipping container, and now we're a professional World Health Organization registered field hospital that we can be a part of.
Thanks very much, Tom.